Welcome to our educational documentary, Fighting for Survival, addressing Nigeria's very high under-5 child mortality rate. In this episode, we continue our deep dive into Nigeria's pressing challenges, focusing on the country's very high under-5 mortality rate. As with all our documentaries, our goal is to provide in-depth context and analysis, helping viewers worldwide understand the underlying factors behind these statistics. We extend our gratitude to our healthcare experts for their valuable contributions. Join us as we uncover key insights and explore actionable solutions to this critical issue. Don't forget to like, share, and subscribe.
The learning objectives are on your screen. The documentary covers the definition and global scope of the under-5 mortality rate, exploring whether Nigeria can meet the World Health Organization's Sustainable Development Goal 3.2. It compares Nigeria's under-5 mortality rate to other countries and regions, discusses the impact of austerity measures and the Structural Adjustment Programme, and provides an assessment of under-5 mortality rate across Nigeria's states. Key causes of high under-5 mortality are examined, followed by recommendations to reduce the rate, concluding with next steps for addressing these challenges. Under-5 mortality, or children dying before their 5th birthday, continues to be a significant global health issue. The World Health Organization defines under-5 mortality rate as the number of children per 1,000 born alive and die before their 5th birthday. On your screen is a color-coded global map of under-5 mortality rate. In the lower left part of the graphic are the keys to the color coding. Overall, there has been a significant decline in the rate of under-5 mortality from 93 in 1990 to 37 deaths per 1,000 live births in 2022. However, a lot more work needs to be done in the African continent, particularly in West Africa. Globally, on average, 35,200 children under age 5 years died every day in 1990 compared to 13,400 children in 2022, signifying an approximately 62% decline in deaths. Children in sub-Saharan Africa face some of the most challenging survival odds in the world. In 2022, Nigeria's under-5 mortality rate stood at 107.17 per 1,000 live births, meaning over 1 in 10 Nigerian children do not reach their 5th birthday. By comparison, the rate was 6.25 in the United States and just 2.28 in Japan. These figures highlight a staggering disparity. A child in Nigeria is 17 times more likely to die before age 5 than one in the US, and 47 times more likely to die before age 5 than a child in Japan. From birth, children in Nigeria or in many other countries in Africa face steep odds, underscoring the urgent need for targeted interventions to improve child health outcomes in sub-Saharan Africa. We have selected a country in South America, part of the Global South, for another comparison. On your screen is a graph of the under-5 mortality rate in Venezuela, brown color, lower graph, and Nigeria, green color, upper graph. In 1970, the under-5 mortality rate in Nigeria was 284, and in Venezuela it was 63. In 2022, 52 years after, it was 107.17 in Nigeria and 24.21 in Venezuela. This highlights the tremendous work that the healthcare sector in Venezuela has done in reducing under-5 mortality rate and meeting the Sustainable Development Goal. The World Health Organization in 2015 set out an ambitious target as part of the Sustainable Development Goal 3, which is to ensure healthy lives and promote well-being for all at all ages. Specifically for Target 3.2 by 2030, end preventable deaths of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births. The additional target is to reduce under-5 mortality to at least as low as 25 per 1,000 live births. The key question is, will Nigeria be able to meet Sustainable Development Goal 3.2? Unfortunately, the answer is no. Nigeria is not on track to meet this goal, which aims to reduce the under-5 mortality rate by 2030. In fact, at the current pace, Nigeria is projected to meet this target in 2050, 20 years behind schedule. Over the next few decades, this delay means that many young lives will continue to be lost. On your screen is a graph of the under-5 mortality rate in Nigeria. From 1964 to around 1980, significant progress was made in reducing under-5 mortality. However, this momentum was stalled between 1981 and 1990, reflected in the flat section of the graph. This was the period when austerity measures were implemented by President Shehu Shagari's administration, followed by the Structural Adjustment Programme under General Ibrahim Babangida's military regime. The progress in reducing under-5 mortality stopped, with the rate remaining nearly unchanged, 209.95 in 1981 and 209.61 in 1990, representing nearly a decade of lost gains. Many young black lives continue to be lost. We have covered this period in other documentaries that also explore Nigeria's excessively high maternal and infant mortality rates. Now, let's take a closer look at the under-5 mortality rate across Nigeria's 36 states and the Federal Capital Territory, FCT. The disparities in under-5 mortality rates within the country are stark, with some regions faring much worse than others. The role of non-state actors, particularly in the northern part of Nigeria, cannot be overstated. Armed insurgent groups like Boko Haram and bandits have caused significant destabilization in these regions, disrupting healthcare services and leading to the destruction of hospitals and clinics. This creates a challenging environment for families and healthcare providers alike, making it difficult for children to receive life-saving interventions such as immunizations, proper nutrition, and medical care. Additionally, the ongoing insecurity has forced many families into internally displaced persons camps where living conditions are poor, further exacerbating the under-5 mortality rate. In these camps, overcrowding, poor sanitation, and a lack of access to clean water contribute to the spread of diseases like diarrhea and pneumonia, which are leading causes of child deaths. The southern regions, while generally faring better, are not immune to these challenges. In places where oil extraction and environmental degradation have damaged local ecosystems, such as in the Niger Delta, children suffer from high rates of malnutrition and respiratory diseases due to pollution. Though non-state actors in these areas may not be as visible as insurgent groups, their impact through environmental degradation and political instability still plays a role in shaping child health outcomes. On your screen are the data of under-5 mortality rate in each state in Nigeria in 2021, including the Federal Capital Territory. Kebbi State in northern Nigeria has the highest under-5 mortality rate with 252.54 deaths per 1,000 live births, followed by Jigawa State, also in northern Nigeria, with 213.22 deaths per 1,000 live births. Bayelsa State in the south-south region of Nigeria has the lowest under-5 mortality rate with 52.25 deaths per 1,000 live births. We applaud the excellent work by the people and government of Bayelsa State. All the other states should emulate the achievement of Bayelsa State. The second lowest under-5 mortality rate is in Ogun State, located in southwest Nigeria, with 55.34 deaths per 1,000 live births. We also applaud the hard work of the people and government of Ogun State in prioritizing the health of children in the state. The table on the left of your screen contains states in Nigeria with under-5 mortality rate higher than the national average depicted in the last row. With the exception of Akwa Ibom State, second to the last row, located in the southern part of the country, all the states with under-5 mortality rate higher than the national average of 110.62 deaths per 1,000 live births are located in the northern part of the country. The table to the right of your screen contains states with under-5 mortality lower than the national average. With the exception of the FCT, Borno, Kwara and Benue states, all the states with under-5 mortality rate lower than the national average of 110.62 deaths per 1,000 live births are located in the southern part of the country. On your screen is a graphical representation of the under-5 mortality rate across Nigeria's 36 states and the Federal Capital Territory. 17 of the 36 states, 47%, have an under-5 mortality rate higher than the national average of 110.62 deaths per 1,000 live births. Notably, 16 of these 17 states, 94%, are located in northern Nigeria, where access to healthcare, nutrition and sanitation remains significantly lower compared to other regions. This regional disparity highlights the urgent need for targeted health interventions in the northern states to address the high under-5 mortality rates and improve overall survival outcomes for children across the country. Let us draw your attention to the states with under-5 mortality lower than the national average. 19 out of 36 states, approximately 53%, have an under-5 mortality rate lower than the national average of 110.62 deaths per 1,000 live births. Notably, 16 of these 19 states, 84%, are located in the southern part of the country. The relationship between ethnicity and health outcomes has been well established. In 2014, as part of their research into under-5 mortality in Nigeria, Drs. Sunday Adedini, Clifford Odumegwu and co-authors reported that children under 5 from the southwestern and southeastern Nigeria, mainly Yoruba and Igbo ethnic groups respectively, had significantly lower mortality rates compared to those from northern Nigeria, predominantly Hausa, Fulani and Kanuri tribes. Some of the key factors they reported as contributing to higher mortality in northern Nigeria include cultural practices like teenage early pregnancy, under 18 years, high fertility, polygyny, limited educational attainment, high birth order, and short pregnancy intervals. The Nigerian government must prioritize reducing these disparities, especially in the north. Our viewers are encouraged to review their publication. Let us pivot to understand the causes of the high under-5 mortality in Nigeria and most parts of Africa. They are blood infections such as septicemia, diarrhea and gastroenteritis, mainly due to rotavirus, and norovirus infections. The other causes are pneumonia, malaria, malnutrition and measles. Due to the poor economic status in the majority of these children, malnutrition is almost always prevalent and contributes to the under-5 deaths. As can be seen, most of these causes are preventable or can be treated. Addressing these causes will significantly reduce the under-5 mortality in Nigeria and in Africa. Our viewers are encouraged to read the 2014 publication of Henshaw Okoro-Iwu, Uwem Edet and co-authors in Journal of Public Health Research for further details. The challenges keep piling up for Nigeria's healthcare system. A high infant mortality rate, an excessively high maternal mortality rate, and now a very high under-5 child mortality rate. These statistics paint a troubling picture of a nation struggling to provide adequate care for its most vulnerable populations. For every 1,000 live births, 107 children die before reaching their 5th birthday, and for every woman who gives birth, the risks to her life are unacceptably high. These overlapping crises stem from a complex web of factors: poor healthcare infrastructure, limited access to quality services, high rates of poverty, cultural practices, and inadequate maternal and child health education. The need for urgent action has never been clearer, and targeted interventions are crucial to reversing these devastating trends. Here are the key recommendations to reduce under-5 mortality in Nigeria. Expand access to healthcare and improve funding. By training, retaining, and improving the remuneration of doctors, nurses, midwives, and other healthcare workers to provide maternal and child healthcare, including vaccination coverage for preventable diseases like measles, pneumonia, and diarrhea, especially in high-risk areas. By also following the recommendation of the Abuja Declaration of 2001 to increase health budget to at least 15% of the federal annual budget. Additionally, by working to meet the target of the Sustainable Development Goal 3.2 of reducing under-5 mortality to at least as low as 25 per 1,000 live births. Combating malnutrition by implementing community-based nutrition programs, promoting breastfeeding, proper complementary feeding, and providing nutritional supplements like vitamin A to infants and children. Promoting education for girls and health awareness by increasing access to education for girls and raising awareness about hygiene, nutrition, and family planning to empower mothers with better health practices. Addressing cultural and religious practices by promoting family planning, including the education of communities about the benefits of birth spacing, at least 24 months between pregnancies, to reduce risks associated with high fertility and closely spaced pregnancies. Delaying early marriage and pregnancy by working with religious and community leaders to discourage child marriage and promote delaying pregnancy until women are physically ready, ideally after age 18. Improving water, sanitation and hygiene, WASH, by increasing access to clean water, investing in clean water infrastructure to reduce diseases caused by unsafe drinking water, such as diarrhea, which is a leading cause of death among children under 5. By also promoting sanitation and hygiene programs to promote good hygiene practices such as hand washing with soap and improving sanitation facilities to reduce the spread of infectious diseases. Strengthening international collaboration and partnerships by partnering with international organizations such as the World Health Organization, UNICEF, World Bank Group, African Development Bank and local and international NGOs to secure funding, technical assistance, and resources for healthcare and nutrition programs. Progress in reducing Nigeria's high under-5 mortality rate has been slow. We acknowledge the publicly available data from international organizations such as the UN, World Health Organization, UNICEF, World Bank Group, IMF, and others. Special thanks go to the people and government of Nigeria, as well as the other countries whose data we reference in this documentary. We also extend our gratitude to the doctors, nurses, midwives, NGOs and volunteers dedicated to the care of under-5 children in Nigeria, and other healthcare workers all over Africa and the rest of the world. Your efforts are deeply appreciated and valued. Nigeria's next steps in healthcare must prioritize vulnerable populations, particularly infants, children, and pregnant women. The government must urgently address the security of the nation, the Japa phenomenon, the rapid emigration of young professionals, including doctors, nurses, midwives, and other healthcare workers to Western countries. Improving their pay and working conditions is essential to curb this brain drain. Doing so will send a strong signal that the country is serious about strengthening its healthcare system and retaining its skilled workforce to improve health outcomes. Nigeria needs to urgently catch up on lost time. The learning objectives showing on your screen have been met. Thank you for watching.
If you enjoyed this video, don't forget to like, share, and subscribe. Your support helps us bring more insightful, informative, and educational content to a wider audience. By subscribing, you ensure you don't miss out on our future videos that delve into fascinating topics from around the world. This video documentary is in collaboration with the Pomuliro Media LLC.